Well, there are no new reports of any confirmed Ebola cases anywhere in this country, but hospitals, including many here in Philadelphia, are preparing just in case.
3 on Your Side health reporter Stephanie Stahl has a first-hand look inside one hospital's emergency room.
The protective gear is ready to go. It starts with gloves here in the emergency department at Hahnemann University Hospital. This is a demonstration of how hospital workers would protect themselves if they get a patient suspected of having Ebola. They're completely covered, including a mask and face shield to guard against coming into contact with any body fluids.
Any saliva, urine, blood is what the concern is.
Dr. Eric Stander in the emergency department at Hahnemann says hospitals have been getting these daily health alerts outlining facts about the virus and measures to guard against it being spread. Like, what if someone walks into the ER with symptoms?
It requires a close contact, so just rolling by somebody is not dangerous.
So you're not overly concerned?
Not overly, no. I just want to be correctly concerned.
He says the most important measure is to find out if someone with flu-like symptoms has been to West Africa or in contact with someone who has.
We've alerted the staff, educated the staff to look for the signs and symptoms of Ebola, and more importantly, to ask the questions.
If there's a suspected case, the patient would be immediately taken to an isolation room called ISO. This is where other contagious illnesses are treated, things like meningitis and tuberculosis. It has a special filter and ventilation system so air from the room doesn't circulate out.
It protects patients in here in the emergency room so that they can't get exposed to anything that's in this room.
Now, while most isolation rooms are outfitted with that special ventilation, it is not really that important for Ebola because it is not spread through the air the way, say, the flu is. Also, we should mention that the isolation unit in Atlanta, where those 2 patients are being treated, much more sophisticated than any other local facilities.
Okay. Get the sense there's a lot of anxiety about this out there, so it's good to have some information.
Yeah.
Steph, thank you very much. We invite you to stay with us.